I'll go ahead and kick us off. I really appreciate you all being here tonight for our Farmington SAFE community conversation on COVID, mental health, and the community. And I think we have a great lineup of speakers that are going to present to you. We've got a few members of the Farmington SAFE team, and we're going to go ahead and get started. Sarah Majoris, one of the original members of Farmington SAFE, will be introducing the speakers as they come up. And with that, I'll go ahead and Jen, do you have some opening comments you wanted to say? Sarah, I will turn it over to you then.
Awesome, thank you. Welcome everybody. Thank you for being here tonight for our first ever virtual forum on COVID, mental health, and our community. We're happy that you could be here and join us. We're hoping that tonight's conversation provides information, insights, and resources on how COVID-19, the pandemic of COVID-19 has impacted our community. We have some awesome speakers tonight. They are in order. We have our public safety superstars from Farmington Hills and Farmington, Police Chief Jeff King, and we also have Public Safety Director Ted Wortham from Farmington. We have Kimberly Guzman. She is here from Beaumont, Farmington Hills. She's the Chief Nursing Officer from Beaumont. We have Fran Brown, who is the President and CEO of the Michigan School of Psychology. And we also have Ann Campbell, who is a licensed clinical psychologist and a school psychologist here in Farmington Hills, Farmington Public Schools. Last but not least, we have Vicki Kennedy, who is here representing Common Ground. She is the development specialist and volunteer crisis coordinator. So we're really happy to have all of you here to join us tonight and share your expertise on this topic of mental health. Before we get started, if everybody could make sure they are muting their microphones. If anybody has any questions and wants to share them, you can put them into the chat or reach out to us later. If you happen to be watching this later on, because we're taping it, you could send us a message on our Facebook page or reach out to us that way too. So without further ado, our first speakers tonight are our public safety gentlemen, and I'll let you guys get started.
I think I'm up first.
Yeah, if you want to go first, Jeff, that's fine.
Right.
Be glad to follow in your footsteps.
Thank you. First and foremost, thanks, Sarah, for the introduction. Thanks to the SAFE team in setting this up and giving us the opportunity to come here and support such a great cause. What I'm going to do is I'm going to go ahead and share my screen. I have a short PowerPoint, and I'm going to do that now. So what I did is I just went through a little bit of information and data, tried to set some information for perspective on a national level, and then bring it into what we are seeing here and doing in Farmington Hills at the police department. So just a few points of data, and if they conflict with anyone, I apologize. There was a web-based survey of adults in America that was conducted over a week in June, and a couple things they found: 31% of those surveyed reported experiencing some symptoms of anxiety or depression. 13 reported having started or an increase in substance use. 26 had some stress-related symptoms. 11 reported serious thoughts of suicide, and that was more than double what was documented from the previous year prior to the pandemic. For law enforcement, from the IACP, which is the International Association of Chiefs of Police, they did a little bit of data collection on COVID-19 effects on law enforcement. They found that overall calls to service for police departments were down over in 2020 during the pandemic compared to the previous year. 47% of the departments saw an increase in mental health runs, while sorry, get black. While 40% showed stable numbers, 28 indicated a decrease. In Farmington Hills, we saw a slight decrease in the numbers, and I'll get to that in a minute. 42% of departments showed an increase in domestic violence incidents, which we'll get into what was occurring in Farmington Hills also. So this screen is our mental health calls for service. As you'll see from 2018, 19, 20, and then up year to date, including April, not May, our calls for service mental health wise are slightly decreasing from 2019 to 2020. But what you'll see is in 2020, it seems to be on the significant increase. Our calls for service broken down 2019, 20, and then 2021. You'll see there is that decrease as I stated, but we've broken it down into 5 different areas: court-ordered petitions or treatments, attempted suicides, other unclassified. Those are usually diversion incidents from the criminal aspect. We have threats of suicide in orange, and then assisted guardian petitions in yellow. What you'll see again is some increases in certain categories, decreases in other. Overall mental health calls we decreased, and the attempted suicides decreased for 2020 from 2019, but in 2021 they're up. We broke it down into by month from the 2019 to 2020, and then again 2021 in April. You'll see they dipped in the 2020 as all calls for service did, including the mental health calls. But then in 2020, we're averaging 5 suicide attempts a month compared to 3 and 4.25 in the previous years. Assault and battery calls, as you'll see, 2020, they did jump up during the pandemic in 2020. We saw an increase in people becoming a little bit more on edge and a little bit more violent even within the household. And we were responding to a significant number of domestic battery or assault and battery, even some neighborhood fights in that year. Again, you'll see some trends. This slide covered some drug overdose, narcotics arrest, and then alcohol-related offenses for 18, 19, 20, and 21. We saw that decrease from 18, 19 continue in 20. But what you'll see is in 20, you see a slight increase in the drug overdoses. And then in year to date for 2021, we see that pattern continue on the increase. A little real quick slide on our resources and our training in our department. When we respond to any kind of a situation, we bring a lot of resources with us. You'll see one of them in top center is Common Ground. Great partners in everything we do, not only in our training for our officer wellness, our mental health first aid, but our Open Mind initiative and trying to facilitate some crisis intervention training for our officers. And we bring all those resources to bear when we are called to a scene to assist, support family, the person in need, even if it's not primarily mental health, but maybe it's narcotics related or alcohol abuse related, somebody suffering from SUDS. We have great partners with our Families Against Narcotics quick response team that we're rolling out this month. So we bring a lot of resources and a lot of quality training. But with all of that being said, one of the trends that I can talk about when we're seeing what we're seeing on these incidents in 2020 and in 2021, 2 kind of trends that are unofficial. They're in the documents, but we don't track these kind of incidents or this data in these incidents. We've seen a lot of increase in not only anxiety and depression in kids, juveniles. That doesn't always equate to someone being petitioned for evaluation. That the laws change when it comes to a juvenile, and the parents are primarily responsible for having that kind of a decision to petition or not. And we've seen a significant increase when we're out and we're talking to kids, and we're discussing some of the issues going on. Even it could range from criminal activity to inappropriate conduct on the child, or skipping any kind of school, even if it's online. We're seeing that the juveniles are expressing a significant increase in anxiety and depression related to things like not being able to see their friends in school, not being able to see family members. Another thing we're seeing in our older generation, when we're intervening on any kind of a mental health or assistance call, is we're seeing a lot of individuals telling us the source of their depression or anxiety or their stress is lack of association with their family, lack of seeing family members. We've been out on calls for service where we've actually taken time to try to facilitate FaceTime for the older individuals that maybe are not as tech savvy as some others are, and we've spent time trying to make that connection to get them in contact with their family members that are either remote, out of state, and those are just some of the trends we've seen. I don't want to dominate too much of the conversation here, but I'll leave this open for questions. But that's kind of the trends we're seeing in Farmington Hills. And with that, I will turn it back over to Ted.
Thanks, Jeff. As soon as you pull your screen down there, I'll share my screen. Yep, no problem.
As I just made a comment about those being having difficulty with technology.
It's at the top.
There it is. There you go. Sorry.
No problem.
Sorry,
Thanks, Jeff.
I'm off.
Okay, I'm going to try sharing my screen now. Give me 1 second here. I think you should be able to see that now. Thank you, and thanks for including me in the conversation tonight. Always good to converse with colleagues about such an important subject, and thanks again, I appreciate it. Just a little bit of who we are over here in Farmington, much smaller than Farmington Hills. We have 23 sworn officers here in Farmington, about 2.7 square miles, population of 10,500. And I think the Hills is somewhere in 80,000, so much smaller numbers we're going to be talking about tonight. And we always pride ourselves in our diversity, not only in race, but age and socioeconomic status as well. I also pulled some information just today from the National Alliance of Mental Illness, particularly Michigan. And some of the interesting statistics I found is that 1 in 5 U.S. adults experience mental illness. There's 1.5 million adults in Michigan that have a mental health condition. If you think about that, that's actually 15% of the population in Michigan. So even though we're only 2.7 square miles and 10,500 population, we are still going to, experience and go on calls and incidents where people have experienced some type of mental illness. 350,000 adults in Michigan have a serious mental illness, and 119,000 Michigan juveniles aged 12 to 17 expressed having some type of depression. Our mental health calls in Farmington, I went back the last 10 years and pulled those up, and you can see with COVID here in 2019, or in 2020 rather, we had a slight increase, our highest to date in the last 10 years. I thought that was kind of interesting. Another thing to note is sometimes mental health calls don't always get coded the way we'd like them to, because we generally a lot of times code them by what we call a higher offense. So if we went on say a domestic and someone was experiencing mental health calls or a mental health issue, that would probably get coded as a domestic violence incident and not a mental health call. So it's really hard to gather real good information. but these are just calls that were coded strictly mental health calls. I just pulled up a couple examples, and these are all from 2021, actually. Kind of the incidents that we are responding to as public safety and police departments, and Jeff could attest to these being similar to the types of runs I'm sure they're responding to in Farmington Hills. The first one there, a juvenile tried to take their life by overdosing on prescription medications. These were her own medications. And luckily the parents intervened, and we were able to get her to the hospital, where her father petitioned her because she was a juvenile 17 or under. The next one there was a call where a 47-year-old resident called police stating they were very depressed after a recent divorce. After a discussion with him, officers determined that he didn't want to hurt himself, and instead of taking him to the hospital, we connected him with family who came over and stayed with him to make sure that he was okay. And the last one there happened a few months ago. A 64-year-old resident started their house on fire and remained inside on their bed. A neighbor saw the smoke coming from the house. Officers arrived, went in the house, and found the resident inside the house. So a large gamut of different types of incidents we're running across in the public safety and police sectors. Our response is dictated by our policy, and I think one of the interesting things that people don't understand is when do we take somebody into custody, protective custody, and when don't we take them into protective custody? And bullet point 2 there talks about that. If someone's a harm to themselves or others, or unable to care for their basic physical needs, that's when we'll do a petition for anybody over the age of 18 years old or over. If they're 17 or under, that's generally left up to the parents, as Chief King stated in his presentation. Another interesting point that I pulled from our policy was officers don't need to be able to diagnose mental illness, but they need to be able to recognize that. And where do they get those recognition skills? From training. We do some type of annual training every year in mental health and wellness. We've sent a couple of our officers to the Oakland County CIT team training, which is a 40-hour class. Love to be able to get all of our officers through the class, but again, it's time, money, and availability of the class. It fills up really quick here in Oakland County. Jail diversion program is a program ran through Oakland County, and it's a community-wide effort between the police departments, the Oakland County Prosecutor's Office, and our friends at Common Ground and Easter Seals. And it gives us the ability to identify somebody that would be much better off getting mental health treatment instead of ending up in jail. And what happens there is, instead of bringing them into the station here and processing them, we run them up to Common Ground, and we get them the help they truly need. So it's been a good program for us. Our partners, Jeff mentioned many more partners, and I know there are more, but there's some of the ones we use commonly here in the city of Farmington. And I thank all of you as partners as we continue to have great conversations like we're having tonight. On a personal level, I had a family member, 44 years old, pass away last April after a long battle with mental illness. And thinking back now, over the years, the elephant in the room was always, let's not say anything, right? We just never talked about it until it was a crisis situation, until things got really, really bad. And then we would start talking about it. So I think that we need to, and I think that's why we're having this discussion tonight, is we need to get out there and make it okay to talk about. Because a lot of times we shy away from these discussions. So, and that's all I have for tonight. Does anyone have any questions for me? If not, I'll try to stop sharing my screen, see if I have better success than Jeff.
Thank you so much, you guys. That was super interesting and informative. I appreciate you both being here.
Thanks, Sarah.
Great information for sure. Our next speaker is Kimberly Guzman. Thank you for being here, Kimberly. And again, you are the Chief Nursing Officer at Beaumont of Farmington Hills.
Thank you. It's great to be here. not only to represent Beaumont and Beaumont Farmington Hills, but I am a resident of Farmington Hills, and I have been for the last 34 years. So it's really near and dear to my heart how we handle all sorts of crises here in the city. And I really didn't know, first of all, I'm not going to share a screen because I am terribly challenged when it comes to technology. So we'll spare you that tonight. And I really didn't know how to approach this topic in a few minutes. So I looked ahead at what all of our speakers and your specialties, certainly much more skilled and trained in treating mental illness. So what I'm going to talk about is sort of the patterns that we see here at the hospital. When COVID first hit in March of 2000, and I don't know how many of you are aware, but Beaumont Farmington Hills and Beaumont Grosse Pointe were the heaviest hit hospitals in Southeast Michigan. We went from, I will never forget our first patient, and I was the one that had to determine what unit that hospital or that patient went to. So I set the unit up, and my medical director came and said, "Okay, Kim, pick your next unit." And I laughed at him. And I said, "Oh, for heaven's sakes, it's not going to be that bad." And within a week, every unit but my oncology unit was a COVID unit. We went from 1 to 158 patients. But we saw some really odd patterns in terms of our mental health and mental illness patients. We usually have anywhere from 5 to 8 patients sitting down in our emergency center on any given day that are in for mental health issues, waiting placement, brought to us by our partners in Farmington Hills, fire and police. And when the pandemic hit, those patients went away. But we were very, very concerned because we knew they were still out there, but no one was coming to the hospital to get treatment. And it was really odd, not just our mental health patients, but our patients with heart disease, strokes, our cancer patients. Everyone was shying away from coming to the emergency center out of fear. And now what we're seeing 15 months later is, even though we're just coming off another surge in the city here, we are now starting to see an increase in our mental health patients coming in. And unfortunately, other patients who have waited too long to get their other diseases treated. So we're also seeing mental health issues with those patients because they put off getting diagnosis and treatment. So now we're sort of, I say, back to whatever our new normal is, seeing our patients in the emergency center and treating those. But now we have another issue that I thought I would talk a little bit more about, and that's our healthcare workers. Through all of this, when you go into healthcare, I've been a nurse 40 years, and you go in and you decide, it's just like when you're an EMT, police, fire, you do this because you have a calling. This is what you want to do. And that's what our staff is like. And when COVID hit, they're like, okay, let's do it. But what we saw amongst the staff is immediate fear. I would round in the units, and you would see this, especially with our caregivers, our younger nurses and our younger physicians and respiratory therapists, because we didn't know how to treat these patients. It was we were watching what was coming out of China, but we didn't know, do we mask or don't we mask? And I can remember going down through the emergency center the first 4 or 5 weeks, and unless you were in a room with a patient, everyone was taking off their mask. And I was walking through the emergency center, no mask, with COVID patients everywhere, because we didn't know what to do. And we had particularly our young caregivers worrying about, am I going to take this home to their families? What we saw with caregivers my age is, not so much worrying about ourselves, but worrying about, my mother lives with me. So what am I going to take home to her? And then we had those senior caregivers who were worried themselves about dying. And so we had all this fear that built up. And, with that fear, then on top of that, we've closed down the hospital and families can't get in. And we've taken away the very support systems that these patients need so much. And not only was that difficult for patients and so very difficult for our families, but the nurses and the physicians and the nursing assistants have now become the family. They're at the bedside. They're the ones with these patients, if the patient is well enough to make decisions, that are helping them make decisions. And if not, they're on the phone with families making very, very difficult end-of-life decisions. We learned very quickly how to use technology to communicate with families. If patients did not have iPhones or the other kind of phones, I forget what they're called, we had tablets that we were trying to connect our families to the patients. But it became very, very challenging for our healthcare workers because they were often the only ones at the bedside at the end of life. And so you take an average nurse who might see a death on a unit maybe once a month to having patients die every day. Because, we did not have remdesivir in the early days of treating COVID. We did not know, do we turn the patients over on their belly? We call it proning to help them increase their breathing. We hadn't learned those things yet. So the mortality in the beginning was much higher. And the healthcare teams were the ones at the bedside taking care of these patients. So after a while, that becomes very draining for the staff, and we see a lot of burnout. We saw staff just up and retire. They said, I can't take it anymore. I can't be a bedside nurse. I can't be a bedside nursing assistant. And they just retired. Those that were much more resilient said, well, I'm going to go where the money is. And they left to go work in, as Michigan calmed down, they went and worked in California and Texas and New York for agencies. And so what we're seeing as a result of COVID is a huge nursing shortage. So you take a year, 15 months of healthcare workers working day and night. I had nurses that were working 7 days a week. And they're the only ones there at the bedside for the family. And then we have folks retire and we have them leave for other reasons. And you have this huge nursing shortage. So they now don't even have the resources that they need some days to be able to care for these patients. You take all that, and what you're looking at is a healthcare team that's emotionally and physically exhausted. And, probably many of you know, because you're on the other side of taking care of us, we don't like to admit when we need something. Healthcare workers are the worst patients. They don't ask for help, and they end up then having problems at home, having problems at work, and be just totally exhausted. And so that's where a lot of our teams are right now. They're very resilient. They're pushing forward, just coming off this third pandemic. But I thought, when we talk about mental health and mental illness, we really need to not forget about our caregivers. I knew all of you would bring all the resources that are out there in the community. So I thought that's better left to you, the experts. But I wanted to paint a picture of when we're talking about helping the community to not forget about all those folks that were out there taking care of the patients during the pandemic, because it really became a challenge. So now what we're doing here is we are looking to some of our resources, And we have a wellness team in the system. We have a wellness team that I chair here at the hospital. And we're doing training for our leaders on dealing with anger, because that's where a lot of the staff are now, dealing with grief. And so we will work with our leaders now, training them to then go back out and work with all those frontline caregivers that gave so much during this pandemic. So I am certainly willing to take any questions that anybody has, but wanted to sort of paint the picture of what COVID has done to the healthcare system. And it's certainly been a challenge. We will recover. That's what we do. And I will turn it back to Sarah. And thank you for your time.
Thank you, Kim. That's super interesting. It's like, who helps the helpers? I think of that. Like, sometimes we forget that. So thanks for reminding us of that. And you can always tell your nurses they can call the Common Ground Crisis Line or use the chat and text service. Like, to be like, you know, if you don't want to care for yourself, if, you know, it's hard if you're a helping person, is like you said. So the crisis chat and text line is a nice sneaky way to do it without anybody knowing, and you don't even have to say anything. But sorry, Vicki, you might talk about that later. So I'm stepping on your toes right now. Thank you, Kim. And
Thank you.
You guys do such a great job. So thank you, and thank all of your nurses, doctors, all your caregivers there.
I sure will.
So cool. All right, our next person up is Fran Brown. She is, again, the president and CEO of the Michigan School of Psychology, and we're so glad you're here today, Fran. Thank you.
Thank you. It's really great to be here, and I feel like all of the other speakers have really set up what I plan to talk about this evening. So I'm going to go ahead and share my screen. And I'm also going to ask Sarah, I keep getting messages that my connection is unstable, but when that happens, people can sometimes hear me, but everybody else looks frozen to me. So I will continue, and if there's a problem, just raise your hand and I'll know that I'm not being, okay, thank you. So I thought what I would talk about tonight is the possible long-term effects of the pandemic on mental health. We've been talking a lot about what it's been like, but the situation, even though, you know, we seem to be out of the woods, I guess, for now with the pandemic, and think about life returning to normal from a mental health perspective, that's not necessarily so. And I thought it would be good to just talk about some of the things that we should be looking for in ourselves and in our families and our friends. So why can't I advance this? There we go. Okay. So during the pandemic, and we've talked about some of these statistics, so I won't spend a lot of time, but anxiety and depression was on the rise, has been on the rise, reported by 4 in 10 adults, compared with 1 in 10 adults pre-pandemic. Substance abuse on the rise, domestic violence, sleep disturbance, chronic medical conditions. Our nursing friend can, I'm sure, speak to that. Difficulty with concentration and attention. I don't know, you know, this isn't talked about an awful lot, but for me, and this isn't just for people who have had COVID, but for all of us that are dealing with the stress of COVID, you know, trying to keep the school going, just speaking for myself, and all of the things that, all of my responsibilities, has been really difficult to maintain concentration, attention, working memory. All that is affected by the stress and anxiety associated with the pandemic. And also they're doing, there's some research being done on what's been called COVID brain. Not only are we experiencing these these symptoms because we're stressed out and maxed out and out of bandwidth, there seems to be a physical component of this disease that affects the brain. And there's a lot of research going on about that right now. So, so why are we experiencing all of these issues? Well, isolation, fear, the overload of news and information, the conflicting news and information. Should we wear a mask? Shouldn't we wear a mask? Changes in work demands. And, the blending of work, school, and home, everything happening in the home environment all at the same time. Change in household dynamics, caregiving difficulties, and financial concerns, obviously, have been huge stressors for everyone. So it's not surprising that, anxiety and depression rose during this time. I looked for some statistics on suicide because of the context of this evening. And, there was a 35% increase in death by suicide from 1990 to 2020. But a curious thing has happened during this shutdown, and the police chief was kind of touched on how some of these numbers are going down. What we're finding is that there's a typo in this slide, but also we're finding that there is that suicide rates fell 9% at the height of the shutdown in 2020. And so there's been some supposition about why that is. It's believed that the availability of telehealth or telemental health provides access to services to people who would not normally have access. And, the insurance companies paying for it, the American Psychological Association approving it for therapists as an accepted modality, that has brought mental health services to more people than ever before. We saw that in our school community clinic, which I'll talk about in a little bit. The other thing, and I know that this was very true at the Michigan School of Psychology, good employers, were keenly aware of their workers' mental health during the pandemic. We spent a lot of time with our staff and faculty, bringing them resources that they needed to function in the new environment, making sure that they had mental health days, providing supports for them. And so, whereas sometimes I think when we're working, we just kind of don't think about it, what other people might be going through. It was really top of mind during the pandemic. Another reason why suicides may be down during this time is because some of the folks that may have suicided actually died of COVID. When you think of the numbers of people who died. And then there's this emotional sense of people a feeling of coming together, a sense of shared purpose. We're all despairing, we're all in this together, which might have affected people's feelings of hopelessness and helplessness. But the beat goes on. Unfortunately, what we have to look forward to in the months following the pandemic is a little frightening or concerning, I should say. So here's some predictions. For 10 to 15%, and I have the sources of this data at the end of the presentation, but for 10 to 15% of people, life will not return to normal due to the impact of the pandemic on their mental well-being. A significant minority will be affected by long-term anxiety, and the mental health impact of the pandemic is likely to last much longer than the physical health impact. And what they're basing this on, what the researchers are basing this on, is how mental health has played out after previous pandemics and national emergencies. And the Center for the Study of Traumatic Stress in Maryland, I believe, had this statement: historically, the adverse mental health effects of disasters impact more people and last much longer than the health effects. If history is any predictor, we should expect a significant tail of mental health needs that continue long after the infectious outbreak resolves. So what can we expect? Well, generalized anxiety disorder affects more than 6.8 million adults in the United States. And of those, only 43% get treatment. So we have a lot of people walking around that are just generally anxious all of the time. 40 million people in the United States are diagnosed with any type of anxiety disorder. So for people who already have general anxiety disorder or a garden variety anxiety disorder, it's expected that it will be exacerbated and worsen as a result of the pandemic. I thought this was really interesting. When you think about obsessive-compulsive disorder, the researchers are predicting a rise in obsessive-compulsive disorder because the disorder arises from the interaction between our genetic makeup and environmental factors. And if you think about the environmental factors right now, and if you know anybody that has OCD, you know, there's a perseveration on contamination, germs, cleaning compulsions, that sort of thing. And so, you know, sometimes I when I'm explaining this to clients, I talk about it's kind of like a needle gets stuck in an old record. For anybody who remembers records, you know, that part of the brain now is been activated, and it's very difficult to calm that down. And it's been exacerbated over a year and a half now. So that's going to be a very difficult thing to overcome. And in order to really avoid chronic germophobia, like paralyzing fear, treatment is needed. Cognitive behavioral treatment, the treatment of a mental health professional. This is not something that we can wish away or treat by ourselves. Isolation. Now, I don't know if any of you have experienced this, but isolation can result in permanent detachment from the outside world. How many of you have tried to go to the store now and not wear your mask because you're vaccinated, and how strange that feels? Or thinking about going grocery shopping or being in large crowds of people? You know, I'm sort of feeling like, ooh, this feels a little bit strange, you know? I mean, I'm really looking forward to it, but I've gotten used to being in this very protective bubble, if you will. And for some people, that's hard to break through, you know, especially if you tend towards introversion anyway. Having been isolated over this period of time can be very difficult to re-engage with the outside world. You know, all of the deaths, you know, there's a lot of folks that are referring to the mental health issues with the pandemic as a post-traumatic stress disorder, that we're entering into a post-traumatic stress disorder period. And the triggering of past trauma related to deaths of loved ones. I mean, there's people have just been dealing with so much death. So not only are they dealing with the death in the present, it triggers the feelings from death in the past. And of course, increased depression due to joblessness and loss of income. So I don't really have anything new. A lot of people are talking about what you need to do in order to take care of yourself. So I just put it up here, limiting the amount of news that you watch and using social media carefully. Super important. And, you know, that's difficult because, you know, we've been home alone. What have we been doing? We've been watching TV and we've been on social media. Taking care of yourself physically with sleep routines, eating healthy, getting out and walking. I have been finding that doing some gardening has helped me, which I haven't really been that much of a gardener, but it just gives me something else to focus on. Mindful breathing and meditation is really important. And, until I became a psychologist, I used to think, oh, breathing, but it really works, because what it does is it oxygenates the part of your brain. It oxygenates your whole brain, but it engages the part of your brain that is responsible for logical thought. So when you're in an emotional spiral and you're feeling anxious, taking deep breaths can help you pause and engage this part of your brain so that it can kind of override the emotional part of the brain. Very, very important. Talking to other people, being sure that you do what you enjoy, and talk to a therapist. And with that, I wanted to offer an additional resource. The Michigan School has recently opened a psychological clinic. It's right on our campus at 12 and Orchard Lake. And it's been developed as a clinic for individuals who can't afford, who either are uninsured or underinsured. So there are lots of people have insurance now for mental health services because of the parity in health insurance. But some of the deductibles and copays in these plans that people are getting on their own are cost prohibitive. And so what we're doing at the Michigan School is our doctoral students and our master's students, under the direction of fully licensed psychologist faculty, are seeing clients for $5 to $35 a session based on a client need. And if somebody can't afford it at all, we will waive the fee altogether. It's more successful if people invest even a little bit in their mental health care. So we try to get that $5 payment, but no one has ever charged more than $35. And it helps our students get real world training, but it also provides a service to the community. The start was delayed because of COVID, but we opened in January of this year doing telehealth, and we have over 75 clients in the community, which is good for a small school clinic. And just not that this is related, we also do applied behavior analysis services for children and adolescents on the autism spectrum. So I wanted to offer this as a referral source for any of you who might run into folks that say, I just can't afford it. There's a low cost, high quality alternative. Okay, that's my little pitch. So this was the time for questions, but barring any questions, I wanted to provide the sources for my data here. I'm glad this is being recorded. So if people want to get some additional information, this is where I got my information today. Okay. Thank you for having me. It's been a pleasure to be here.
Thank you so much, Fran. That was so interesting. And as an anxious gal myself, you were just hitting the nail on the head for a lot of things for me, I have to say. Question about that counseling service you were just mentioning. Is
Yep.
that open to people just in Oakland County? Like if I'm taking calls?
Anybody.
Okay.
Anybody. And we see children, adults, adolescents, families, couples. The youngest we see for therapy is 5 years old, but we do see, early intervention for ABA starts at 2 years old. But that's just for the autism services, but anybody ages 5 and up.
That is awesome. Thank you so much. Well, I'll share that with my Common Ground crisis line mates.
Yeah, and I wanted to mention to the folks at Common Ground, our clinic is not a crisis clinic. So, we don't deal with the police need to bring somebody to a clinic because of suicidal ideation or domestic violence. These, although our students are very good and they're advanced, the real heavy duty crisis, we send folks to Common Ground. So just wanted to let folks know about that.
Very good. Thanks for clarifying that. That's important to straighten that out for sure. Thanks,
Okay.
Fran.
You're welcome.
Interesting. So glad you could be here. All right, our next speaker is Ann Campbell. She is a licensed clinical psychologist and a school psychologist in the Farmington Public Schools. So take it away, Ann. Thank you for being here.
Thank you. I don't know if I can share my screen or not. I was just going to talk. My specialty is in child psychology, so I'm a child psychologist. And I have a private practice which has seen an increase in client referrals this year, again, mostly with anxiety and depression. And I'm also at Farmington Public Schools in the high school. And also I'm a social emotional support person at Gill Elementary. So the schools, Farmington Schools has a program with you can jump down to slide 5. We're working with the younger kids on social emotional support. So all the kids have, we've had a lot of uncertainty. They've had multiple changes in schedules. So we go in and we do weekly lessons with the kids on identifying their feelings, building empathy for others, giving them ways to cope with strong feelings, encouraging them to talk to adults in their life about their feelings. We tell them all the time that the adults want to hear how they're feeling, sort of in relating to what Ken said, to what Officer Wortman said. We want to have these conversations on a regular basis. We want to know how you're feeling. If there's something up, we want to be there to help, and we're here with you to problem solve. So anyways, just to let you know, my point of view is all coming from a very child-centered, child-focused approach. So in dealing with the pandemic, I went, instead of researching the data, which you guys have all done a nice job of sharing and identifying what's going on with the community with the pandemic, we spoke to myself and a social worker at North Farmington spoke to the kids, and we asked them, what has been the hardest thing of dealing with the pandemic for you? And the order that they gave it to us was social. The hardest part for the kids, obviously teenagers, has been not being able to see their friends, not being able to go places, and being isolated. The second hardest thing they identified was just school and managing schoolwork. Even though as a district, the school has been working to be very flexible and minimize the demands and cut the standards and the grading as low or as minimal as we can, understanding that kids are under stress and in all different kinds of situations. The kids have had a really hard time managing virtual challenges, just being on a screen. A lot of kids get tempted to be on YouTube while they should be in class, those kinds of things where there's a lot of competing demands for their attention. And just having help with the work. It's a lot harder to learn via a screen than it is when you're in person. It's harder to teach and it's harder to learn that way. And it's a long day of sitting for them and a lot of isolation. A lot of kids also said that the difficulties they were having were in routines, maintaining a good sleep schedule, being able to keep track of things. And like I said, the school districts had multiple changes in schedules. We're in person. No, we're not. We're virtual. Then we're doing hybrid. Then now we're back to in person in January. So these kids have had a lot of uncertainty and changes to deal with. And then also they've had worries about their family, about the health of their grandparents, their own health, those kind of concerns. So in terms of the hardest things that they've been dealing with in the past, I feel like this is moving forward, but this is what they've been struggling with all year. When we asked them what has helped, adults have been the most helpful in terms of getting parents and guardians to help them maintain their routines, to encourage positive sleep schedules, maybe to take the phone away at night or limit their electronics. That, they might not like it, but they'll identify that as helpful. Helping them with their homework and organizing work, where to find work, because every teacher seems to have it in a different spot. So those kinds of things have been helpful. Emotional support from adults in their life has been especially helpful. For us as adults to be able to listen to them, to be present with them, to hear their feelings. And this is much like the work that I do at the elementary level. We are there, the teachers and my feelings class, we work a lot with the kids on check-ins. So every morning before every class, there's a check-in. How are you feeling? And we have all kinds of activities and exercises that the teachers are doing to help connect with the kids and to provide that emotional support and check in with how they're feeling. And we encourage them all the time that, again, we can't say it enough. The adults work here. We care about them. We want to know how they're feeling. We don't want that elephant in the room where someone doesn't want to say how they're feeling. Talking about it is helpful. It's not going to make it happen. It's not going to make a suicidal person worse. It's not going to cause a person to be suicidal. It's there. What we want to communicate is that we are there to go through it with them, to help them with it, to problem solve with them. That we're their partners and we're here to help them. So we want to hear how they're feeling. And the kids identify that emotional support is helpful for them. So we try to tell them all the time that that's what we're here for. Socially, being able to see their friends is enormously helpful. I know a lot of parents got very creative during this pandemic with setting up outdoor movie theaters at their house or screens in their garage, or figuring out different ways where the kids might be able to have a bubble of kids they could see, or safe conditions that they could operate in and interact in. And that is a huge thing to kids. I think the social isolation has been the hardest for them. And that seems to be getting better as more people get vaccinated. Hopefully they'll be able to, and as we move into the warmer months, hopefully they'll be able to do more outdoor things together. The other thing that has been, they identified as helpful, there's some silver linings in this pandemic. I think that it's important to look at the positives. Kids have had more time with their family. They felt more connected with their family. Sometimes being able to go on family walks or walk the dog together or bake or cook together with family, those kinds of things have been helpful to kids. Having a job or a purpose or responsibility is very helpful. And the kids identified that. I've had quite a few of my clients that have really looked forward to doing things with family and having things that they do with their sister or with their parents. Even some of my, one of my clients that has some intense anxieties and was spending hours daily thinking about death. We flipped it over to being able to think about life and how she's living, and she's been able to really turn it around in terms of being able to do one loving act towards each family member every day. And she now keeps the chart, and I don't have to remind her, and it's helped her focus on, it gives her a purpose, and it helps keep those worries at bay. So anyways, that having a purpose is good too for people that are feeling isolated. The other thing that the kids identified as helpful is having things to look forward to. So as parents and as adults in their lives, it's helpful if they know that they're going to see a friend in 2 weeks, or they know we're going to do something special as a family, or putting things on the calendar that they can look forward to makes a big difference. difference. That helps with that sense of isolation and hopelessness or any sadness that they're feeling. Having things to look forward to was identified by the kids as being very helpful. So I think one of the other positives I would say one of the other positives that's happened with the pandemic, I think, has been, as Fran mentioned, was people are more aware now of self-care and managing stress. There are a lot of resources out on the web, and I have some slides with links to resources, but there's a little bit more emphasis now on self-care and stress management. There's a lot of apps out there for calm, for breathing. There's Pixel Thoughts where you put the worry in and it spreads it out and dissipates. So it's sort of meditative. There's all kinds of resources available now to help kids and probably the adults that are doing all this helping too. We need our stress management tools too. So just in terms of resources online, there's all kinds of websites. If you want to, let's see, which slide did I have? I put links so that probably if you go to the next slide, the social emotional resources, yeah. So there are links in here and we can put it in the chat, but there's all kinds of self-care links, tips for getting a good night's sleep, helping kids cope with stress. There's a lot of mindfulness apps out there that you can get on your phone that are useful. There's books that I have included. And then if you want to go to the next slide also, wakelet.com has a lot of resources. One of the things we've worked with kids on is helping establish a sense of control because we are dealing with so much uncertainty that's anxiety producing. They have a lot of different ideas. There's Let's Do Something is an organization that is linked once you get in that Wakelet, and it has all kinds of really creative, cool things that kids can do, organizations that they can get involved in where they're doing some positive, proactive, community-minded activities. And the variety there's just all kinds of things out there. So that's linked in there for you as well. Then I also put in some links for parent resources. That's slide 7. So, and the CASTLE website again has all kinds of things for links with information and resources for parents in working with kids. So, are there any questions? And I want to thank you for including me. And I know we're expecting, a lot of difficulties this fall too. The school district has, I guess one of the other positives is we've had more funding for mental health. And we'll have more people like myself doing social emotional learning with kids in all the classrooms. So all the elementary schools will be there full time instead of dividing up our time like we do now.
Thank you so much, Anne.
Thank you.
Appreciate that. And somehow we will get all those links. I don't know. Can you email them to us, Anne? And then maybe we could go that way and then put them on our Facebook page or our website.
Yeah, I sent them to Ken, but I can also send them. It's just the one, you open one and it leads to lots more. So I didn't have slide room for all that.
No, it's okay. No,
there's a lot of stuff out there. And as Fran said, breathing and just taking a moment. We work with the kids on stop, identify your feeling, and calm down. So we have all kinds of songs and activities. And there's all kinds of resources out there to just help slow things down so that you can solve your problems or talk to someone about your problems.
It's so cool. And it applies to grown-ups for sure as well.
Yeah, I think I always get something out of the lessons for the kids.
I know. I just Googled like breathing visualizations to help someone recently, and it was so amazing. It's like this bubble, and just the feel of it, it just was very calming. So there is so much good stuff online for sure. And you mentioned so many. So thanks for all that you do. And thank you for sharing all of that with us here tonight, Anne. Appreciate
Thank
it.
you.
Hey, Anne, will you check the chat box for a note I put in there that's relevant to what you do? Thank you.
Oh, sure.
Okay.
And I know we have people who might want to ask questions, but maybe we can just wait till the end if that's okay.
Okay.
Good. Was there something else? Somebody was just going to say something and I stomped on them.
Nope.
All good. Okay. All right. Our last speaker tonight is Vicki Kennedy. She's here from Common Ground, a place that's near and dear to my heart, in case you haven't noticed that already. Again, she's our Common Ground Development Specialist and Volunteer Crisis Coordinator. So thank you for being here, Vicki. Appreciate it.
There isn't anywhere I'd rather be tonight than with you guys. Farmington SAFE is very dear to my heart. I love doing whatever you guys are got going on. You know you're going to find me there. So thank you, Ken, and thank you, Sarah, for reaching out to invite Common Ground. And it's my pleasure always to talk about this incredible agency that Sarah and I absolutely adore. We know that we are a 24-hour in-person and phone and chat and text crisis center. I probably don't have to describe Common Ground because you guys probably all know us very well. But let's just say we dedicate to families, kids, and youth and adults in crisis. Honestly, through our crisis line and in-person visits, we handle over 90,000 people a year. And we work very closely with each and every single one of you guys out there, and we couldn't do it without you. During COVID, it was difficult for a lot of different reasons. We remained open. We remained operating. We served everyone that came to us, whether it was in person, by phone, chat, or text. The resource and crisis helpline, they were up 50% in the first few months of the pandemic. It was a really big scramble because the staff for the crisis helpline was relocated to administration. Administration was sent home to work, which, by the way, we are the forgotten employees that are still home working, not allowed to go back to work in office. And we had to tell our volunteers, we love you guys, but please sit tight. And they were extremely patient during this time, and we were short-staffed, and the phone lines were up 50%. So it was really tough in the beginning. Our in-person visits at the crisis center were down, which meant people were not getting the help that they deserved. And as you guys saw in the first two, speakers, all the help that they had to go out and provide because people couldn't get to us. They couldn't come in, or they didn't want to come in. So there was a lot of people out there not getting the help that they needed. We followed all the CDC guidelines. We had to adjust not only at the crisis helpline level, but we had to adjust in our emergency unit. We had to adjust in our adult crisis residential unit, and we had to adjust at our youth program in Royal Oak. We had to adjust and accommodate to social distancing, which meant we could only take in a few kids at the sanctuary. So our numbers were down because we could only take in 1 or 2 kids to accommodate social distancing. And that was hard for them when they got there. And anxiety was at an all-time high for them, honestly. My daughter worked in that building during the first 8-9 months of COVID, and it was tough. the kids come in the middle of the night or during the day, and you don't know where they've been, and you have to run all the tests, and you have to keep everyone safe. And we've done that by following all the CDC guidelines, and us working from home, and writing grants and getting the PPE and trying to keep everything up and running from this end of it. I jokingly say that we're the forgotten employees, but honestly, they know that we're here. They know that we're working hard for them. The one thing that Common Ground needed to do, and this pandemic did help, is we needed a new phone system. So during the shutdown, we really didn't have a choice. We installed a new phone system, which was amazing. It allowed volunteers and staff to continue to do what they do from home. So that is when we started getting a little break on the crisis line, helpline, is when we could get those volunteers back in to work from home, like Sarah. And we could let a lot of our staff work from home. And therefore we could start taking care of all of the increases in calls, chats, and texts that were coming aboard. We could help the other employees that were taking most of it on themselves, because a lot of staff couldn't come in the building at first. So it was really nice to have that phone system up and running and be able to start using it. Thank goodness for IT people doing amazing stuff during this time. You know, one of the things that was hard is our volunteers love to come in. And I know, Sarah, I think you had a little video when you first got to come back in that you just took from standing outside looking at the building, and how excited you were to come back in. And honestly, it brings tears to our eyes just thinking of how lucky we are that we get to start now bringing all you guys back in, one per shift, because we're still social distancing, and we're moving about that really slow, but honestly, it feels good. And just so you know, volunteers got to come to work before me. So you are important. You're essential, and we couldn't do what we do without you. So development has been working really hard to maintain all the PPE, make sure we have the proper equipment, make sure that we're learning how to use Zoom and Teams and do all that stuff from home. But the one super amazing thing is we've been writing for a behavioral health urgent care. We have done the telehealth, but we are expanding. We have a behavioral health urgent care opening virtual this year in the next few months. And we expect a brick and mortar building by somewhere in South Oakland County in 2022. So we know the need is out there. We're looking to expand to accommodate that need. And we're here looking to help everyone that deserves all the help that they can get. Also, a really cool thing is this is our 50th year. We have been out here saving lives for 50 years. So it's a really huge, it's huge. And it's a proud moment for us. And it's awesome to be part of this amazing agency and helping people. So, I didn't do a slide, sorry. I do better just by talking.
It's fine.
That's pretty much what we're doing.
Thank you so much, Vicki. Did you see, I don't really know like the data, but like higher call volumes for like domestic violence or more suicidal calls, or what did you see in the crisis room?
I honestly don't have the numbers for that because I was sent home. Melissa Bowman would probably know that, or Kyle.
Okay. Yeah.
But honestly, the whole agency, especially the Victims Assistance Program, and they saw a huge increase in domestic violence. Everyone was home. It was terrible. The domestic violence calls were up.
Yeah.
And now that we've gone almost a year and a half, suicides are up.
Mhm.
But yeah, it's hard. It's pretty cool because now that I have a family member over there answering phones, it's pretty proud to pass the baton off to someone else and see that great work continuing.
Nice. Very cool. And we did just start back up the survivors of suicide loss support group. It just started back up via Zoom, which isn't ideal, but it's okay. It's okay.
Yeah.
So that's still first and third Mondays of the month on Zoom. And if anybody's interested or wants to share that, if you can call the crisis or the Common Ground number and get info about that, check out the website.
Did you see that we are partnering with Ferndale for our mobile unit to go out with the police departments to de-escalate?
That's great.
We partnered with White Lake and it worked out really well. So now we're partnering with Ferndale. So
Amazing. Thank you so much, Vicki, for sharing all of that with us.
thank you for having me.
Our pleasure. So I do think people might have questions. If anybody wants to like unmute, Ken, I don't know if you have.
Sarah, I do see that some folks in the chat room do have questions, and they can go ahead and unmute themselves and ask those questions.
Okay. Thank you again, everybody, for being here. I do think there are like words that haven't even been invented yet to describe what we've been through. Does anyone have any questions?
Yeah, now's the time for that discussion. If not, I have just a couple of slides to close with.
And maybe somebody's TV is on or something, if they could turn that.
I think that's Ken's,
Oh, I'm sorry.
Other meeting.
yeah,
Sorry.
he's
Didn't mean to-
That is,
multitasking.
that's exactly what that is.
Didn't mean to bust your chops right there. Sorry about that.
It's the dialogue is becoming very interesting. So anyway, I'll go ahead, and if nobody has any questions, first of all, I do want to thank everyone for your time today. And I think I have, this one. And so the Farmington SAFE is our, we're all here because we know about Farmington SAFE, but it's our dialogue. It's about changing the dialogue around mental health. And that said, there are a couple of takeaway messages that I like to always bring up with every single one of our opportunities when we talk to folks. And that is that we are a community that cares and we can make a difference. And that's why we're all here tonight. And I thank you for doing that. But to make the difference, to make that a reality, we have to know there's an issue. And that's what we're here to talk about. And the viewers of the recording will actually understand that. We have to have information, and these subject material experts have shared that. We have to know what to look for. Then we have to ask challenging questions, and we have to have those difficult conversations and know what to do with the answers when we get them. And that's why we come up with our little saying is that we have to talk about it. And, that is what Farmington SAFE is all about. And I always use this slide at the end of one of our community conversations. And I just want to say that we are supported by the city, both cities, and there have been resolutions that formed Farmington SAFE. The schools have been part of that. Our business sectors have been part of that. And it's all the people out there that need us and need this information. And by the way, Farmington SAFE, the only place we end up getting any funding, is most of you, at least on Farmington SAFE, you all know that my stepson, Graham Smith, died by suicide, and his trauma-versary was 10 years ago on May 9th. But we took the opportunity to create a memorial fund. It's a 501c3, and all of the donations that go to that, and we have 2 fundraisers a year, well, not through COVID, but we will have one this year, which will be our softball tournament. And Ann, I'll tell you, you can take that back and get us some school, a couple of teams that will take out all of the old people to play. So I'm just throwing that out there. But that is our funding source. So I always like to share that, because all of the funds that are raised by the Memorial Fund go to support the events like this one that Farmington SAFE does. And with that, to each of you, and I see Lynn Halton's there from Farmington Youth Assistance. She's the chair of Farmington Youth Assistance, and we share a number of different common missions. So we definitely appreciate that. But Sarah, Jen, thank you. To Chief King, thank you for your time tonight. To Public Safety Director Worthman, and I know both Chief King and Director Worthman are on Farmington Youth Assistance as well. So we're all doing double duties. Fran, for the busy schedule you have, it must be crazy. Thanks for being here. Ann, nice to see you again. And thanks for your time today. Vicki, it's been great. Thank you for your insights and what you said about Common Ground. And Kim, what an interesting perspective. I mean, we all talk about people being ill, but you know, you got to go to the hospital. We have to take care of our hospital folks too. And in your presentation, bringing up all the stresses that all of our first responders and our frontline healthcare workers have been going through in the last year plus. It's great. So thank you for taking the time to be here. So with that, Sarah, Jen, anything else you guys want to add? Or okay, if there are any questions.
That was very informative. Thank you.
Yes, thank you.
Excellent.
Yep. And the recording will be posted on the Farmington SAFE YouTube channel and the Farmington Hills YouTube channel. So that'll take a day or so to get that up there, probably early next week, given the holiday. But with that, thank you so much and have a great evening.
Good night. Thank you.
Good
Good night. Thanks.
Right.
Bye-bye.
Thanks.
Good night.